Hello, everyone. My name is Mike Clark, and I'm welcoming you to our first virtual event supporting the people in Chimbote, Peru. In the year 2000, I made my only trip to Chimbote, and the people there have been in my heart ever since. So we welcome you to this celebration of the people we support since 1963. The year 2020 has presented a challenge for all of us here in Pittsburgh and throughout Western Pennsylvania and beyond, but especially our friends in Chimbote, Peru. While the pandemic has hit us hard here, today the government regulations in Peru during the pandemic are causing a significant disruption to the services and the programs at the Center for Social Works. They are required to close facilities, all of them except the maternity hospital, emergency clinic, orphanage, the lab, and the pharmacy. No home visits are taking place during the shutdown.
Because 6 months ago today changed our whole way of living. We went to bed on Sunday night, the 15th of March. We had heard some of the reports from the states, that there was this new virus and that, well, don't worry, it's like, another flu and so on and so forth. Monday morning, unbeknown to us, because I don't listen to the late evening news, some cases of the coronavirus had appeared in Lima, and the president immediately put everything on lockdown and said that norms would be announced in the morning. So we got up to an empty center, practically. Everything is still on lockdown. We still have curfew. Sundays is a complete close down of nobody leaves the house. I'm just grateful to Almighty God that the personnel stepped up to the plate like you would not believe. It was, their idea of mission and taking care of the poor lacks nothing. I am just so surprised at their willingness to readjust, to do things calmly, to keep calm, that they'll be taken care of. Just give us time to move. We can't have a lot of people in one place at one time. Please understand.
The situation has been so bad, hard on the people, because the markets are closed, because so many of them were poorly kept and many of the employees were positive for coronavirus. So most of the open markets were all closed, and people have their stands there where they make their living by selling food, and that's how they live. And now that all those are closed, they have no place to go for food and other maintenance stuff. So they really are suffering. So when we come out of all this, we will be making ourselves very available to the people that who have health issues. But you see, it's very hard because of the way the people live here. There are so many in a house. Their water supply is very poor. How are they going to maintain washing their hands, wearing a mask, and keep distancing? So it's a real challenge to the people every day, even without the quarantine or the pandemic. We never stopped working. We always had our emergency department opened 24 hours a day with doctors. We had one doctor in the outpatient clinic, which helped us, move the patients if they needed to go to the hospital, or because they're all screened before they come into the center. And there are always questions if they have any coronavirus symptoms. If they do, they are not allowed in. They have to go out there's one center at Regional Hospital that takes care of all the suspected and the cases of that. But we have always had deliveries. Of course, that's very restricted now. It's just a woman, the husband, no one can go in with her.
Pittsburgh has helped us over this hump. And considering, because of the number of patients and the number that do contribute some, we have not done badly. Let's put it that way. We're not back to where we were before as far as income goes, but we'll get there.
The coronavirus pandemic has hit our mission in Chimbote extremely hard. Our medical director for the Center for Social Works, Teresa Salinas, after a 2-week battle with COVID-19, passed away. Teresa spent her entire professional career at the Center for Social Works, starting as a substitute midwife in 1974 and eventually becoming the medical director in 2011.
She was just very unique. She had a special charisma about her. She was specially chosen, actually. She's a very gifted obstetrician, very, very good. And then as director, she was just so kind to the poor, to everybody, but she was just so kind and so patient, And sometimes you wonder how she could be so patient, but she was just so patient and so kind and always had time for everybody. And she always seemed so calm. But anytime there was a crisis, she would just look at it and then she'd say, I just stop and I'd say so, and then I just go to work. And that's just what she did. She was just always, she was always on mission. She was always on mission. And the people, workers respected her so much for that. And they just carried on her mission.
The mission, while still operating, has been required to cut back to only essential services, so income is greatly impacted.
I would like to say to them that I don't think most of them have any idea what it means to the people here that they maintain such an interest in the needs of the poor. I know they miss the visits. They always look forward to people coming. It renews their commitment to continue to serve the poor. I don't think they realize the economic help is essential, but the moral support that visitors and just the fact Pittsburgh, they know people have called, have checked, have done several things through this. They feel like they're almost members of the family there. It makes it gives them an inner tranquility that somebody cares. And I think that is essential. And I think that's why they can so give of themselves the way they have given in these last months here. From the example that people often wonder, how people from so far away can care so much. And they look, like I say, it's mentioned constantly. And they'll always say, but, Pittsburgh's not going to leave us, are they? So that's all I can say is I hope the people there realize that it is more, their money is needed to help if we're to do the work we do, but their spirit of love and giving has meant just as much.
Your ongoing support helps to provide a safe living situation for all of the vulnerable people, especially children, including providing food, clothing, and medical care. It also enables the caregivers to provide a stable, loving, and nurturing environment for all of them.
I think we'll be dealing with some things we dealt with when we first came here, like malnutrition, and we'll work together and do it slowly like we did from the beginning. And hopefully the sun will shine.
It's a sure bet that none of us could have predicted last year where we would be this year for our annual Peru Mission Dinner. But here we are, our 55th annual dinner and our first ever virtual mission dinner. Think about it. calorie-free. There are many prayers that are running through my mind in these most challenging times. But first among them is a prayer for you, for your good health and that of your entire family, but especially for the health of all of our sisters and brothers in Chimbote, for those on the staff of Maternidad de Maria, our maternity mission hospital, the clinic and children's shelter, and especially for the poor and marginalized whom they are privileged to serve. While 2020 has been a rough one for our diocese, and I'm sure for you too, imagine what it must be to live and serve in Chimbote. Increased costs for regular testing of staff for COVID, higher costs to provide masks and other protective equipment to staff members. The center can only open part of its services to the public, and this is affecting its income. Decreased income because fewer paying patients can get to the center. Increased costs because the Chimbote government requires the center to pay workers even when they can't come to work during COVID. In the midst of these challenges, you and I, as the Church of Pittsburgh, have been sending $20,000 per month to Chimbote to help them cover these increased costs. You and I take for granted those instructions we become so used to. Wash your hands frequently, wear a mask, keep a safe social distance. But think about what a challenge that is for the children of God who live in abject poverty, in crowded barrios, separated by walls of flimsy reed mats, with limited access to clean water. And imagine the challenges experienced by the healthcare and social workers who are our feet, hands, and hearts serving their needs. Thank you. Thank you for never turning your back on those in great need. Thank you for pouring your hearts out for our sisters and brothers in Chimbote. Thank you, people of Pittsburgh. The precious gold of our black and gold is found in our huge hearts of gold. You are simply amazing, never surprising, always amazing in your generosity. Thank you.
When I think back to my journey to Chimbote, Peru in the year 2000, I think of the answers they gave us when we asked them, what do you need the most? Their answer was consistent. They said, please tell the people of Pittsburgh to keep the prayers coming because they believe that you are the answer to their prayers. So whatever you decide to do this year in considering supporting the Chimbote mission, with your time, your treasures, or your talents, please continue to pray for the people. They're counting on it. From all of us involved in the mission work in Pittsburgh and 4,000 miles away in the desert of Chimbote, Peru, we thank you.